Hi, I'm Dr. Julia Ward, founder of Balanced Body Functional Medicine. Today I want to talk to you about pellet hormone therapy, specifically why it works so well for so many women, even though it uses what's called a superphysiologic dose of testosterone. If that sounds a little alarming at first, don't worry. I'm going to explain what that means and why it's actually safe, effective, and often life-changing. First, what exactly is pellet therapy? Pellet therapy uses tiny, customized implants that are placed just under the skin, usually in the hip area. They look like that. These pellets release bioidentical hormones like testosterone and estradiol at slow, steady rates over several months. It's a delivery method that mimics how your ovaries used to work, providing a natural, continuous flow of hormones. Now, one question I hear a lot is, why are testosterone levels with pellets higher than what the lab says is normal? Great question. And the answer lies in how we define normal versus optimal. First, lab reference ranges are based on averages from the general population, but they don't necessarily reflect what feels best for you. Many women feel amazing with levels above the so-called normal range, with more energy, a better mood, improved sleep, and a stronger sex drive. So instead of chasing a lab number, we focus on how you feel and how your body is functioning. Second, the pellet therapy provides consistent hormone delivery 24 hours a day, 7 days a week. Unlike pills, injections, or creams that spike and crash, pellets maintain a steady hormone level, which helps reduce symptoms more effectively. Third, women are incredibly sensitive to testosterone. Even small increases can have a major impact on brain function, metabolism, mood, muscle tone, and sexual health. So when your labs show what looks like a high number, your body might actually be right where it needs to be. Fourth, with pellet therapy, a lot of the hormone is absorbed directly into surrounding tissues. This means the therapeutic effect at the tissue level is often much stronger than what we see in a blood test. So again, don't be too focused on the number. Focus on how you're doing. And fifth, pellet therapy has actually been around for over 80 years and has been used safely in hundreds of thousands of women. There's strong research, especially from the website hormonebalance.org, supporting both its safety and effectiveness. Now, hormone balance is a big part of feeling better, but it's not the whole story. When I meet with new patients, I want to make sure we're not missing anything else that could be going on. Things like stomach issues, brain fog, fatigue, and other symptoms that just haven't been explained. If you're feeling off, and if you've been told that your labs are normal, you might be dealing with something deeper, like mold exposure, Lyme disease, heavy metals, or even an autoimmune condition. That's where functional medicine can really help. We dig deeper and look for answers that others might miss. And if you're someone who's just trying to stay healthy and take a more proactive approach to aging and wellness, that's something I love helping with too, because it's what I do for myself and my family every day. One of my favorite tools is a genomic testing through Intellex DNA. It helps us take the guesswork out of what supplements, medications, diet, and lifestyle choices are likely to work best for you, based on your unique genes. It's a powerful way to personalize your care and make smarter choices about your long-term health. I also use a tool called GlycoCheck with all of my new patients. You can learn more about it at glycocalyx.com. It looks at the health of your tiniest blood vessels, your capillaries, which are responsible for getting oxygen and nutrients to every part of your body. When your microvascular system is working well, your whole body works better. It's especially important if you have high blood pressure, kidney issues, brain fog, or if you're preparing for surgery. This is where some of the most profound healing begins, deep in the body at the cellular level. I'm always learning, always studying something new, because I truly care about helping my patients feel their best, not just today, but for the long run. So whether you're looking for answers or simply want to stay ahead of the game with your health, I'd be honored to support you. Thanks so much for watching, and I hope to see you soon.